I've just come back from the clinic.
Uh-huh. What did the doctor say?
It takes at least additional 2 weeks.
Oh, another 2 weeks?
Yes.
Well, it's something to look forward to, I guess, right?
Yeah. Yesterday I went to the coffee shop. Before I went to the place twice or 3 times a week. But after getting injured, it was the first time to there in these 4 weeks. She
Mm-hmm.
was worried about me. What happened? Then I went there. I'm sorry I couldn't come here because my face was covered by bruise or cloth, a lot of things.
Mm-hmm.
Uh, then she said, "Are you okay?" Yes, yes, now okay. My arm is not so much painful.
Yeah. So you see a lot of different types of folks that come to the clinic, right?
Yes, yes.
Is it a is it a larger clinic or just a
Very
what?
small clinic.
Uh-huh. Just like a kind of like a community clinic, right?
Yes, yes. Mm.
People come in and there's probably a few doctors, maybe a few nurses, right?
Yeah, yeah, that's right.
Nice, nice. That's good. Here, honestly, most of the clinical settings that I've seen are, they have places where they do surgery. They have places where it's just an office area for doctors. So many different things like that. Um, I've mostly though, like for my job before, I did a lot of traveling to hospitals actually, so larger hospitals, and yeah, I didn't have that much experience with clinics, but I do remember once upon a time I watched um, a documentary on healthcare in different
Mm.
countries, and this question about Japan was actually one of the countries that was studied in that documentary as a country with a very good healthcare and very good access to healthcare actually.
Mm.
Um, Even though today I had another class with Ken, and Ken said that I think the taxes are maybe 30% for healthcare in Japan, right?
I'm not sure.
Uh-huh. He said something like 30%, and then he said that for seniors it's
Okay, okay, and payment, payment.
yeah, for payments,
Yes,
I think, right?
30% we need to pay, and
30% is to pay.
70% the national insurance covers.
Uh-huh. Exactly. So the 30% that you guys need to pay, it's usually not that much money, right?
Yes, yes. Usually I don't pay so much. Every day
Uh-huh.
I need to clinic for my arm treatment. I pay only 390 yen every day.
Uh-huh. Yeah, that's really good. Compared to a lot of the situations that we have in the US where we don't really have a national healthcare system,
Mm.
a lot of people are very burdened, by their healthcare costs. So,
Mm.
excuse me, one of the biggest things that we're seeing right now in the US where we're having a debate actually is a debate over healthcare. Should people be obligated to have health insurance and should the government supply part of that health insurance or
Yeah. So
provide for
I
that health
always said
insurance? Yeah.
it's kind of donation.
Yeah.
Rich people can pay the money, but the poor people can't. Then poor people, when they got injured or illness, they can't go to the doctor if its payment is very high. So rich people need to pay the money.
Yeah, no, absolutely. Rich people pay the money. And I mean, it's something that I think the debate in the United States is nobody should be forced to have health insurance. Like,
Mm.
one of the people who, or not one of the people, but I guess the group that is against the national model or this increased access to healthcare, their argument is nobody should be forced to have healthcare. It should still be something that is a personal choice.
But
But
if your payment to go to the poor people, they can access the hospital and even they are giving birth. Even poor people give the birth. They need to go to the hospital for their kid. Their babies have no. no responsibility about their situation. Why a poor baby need to die without going to the doctor, right?
Yeah, no, absolutely. That's with babies actually, everybody is very sympathetic. There is no debate, right? So young children, as well as infants and babies, they are covered by government, protection, government laws. And then the other aspect of U.S. law that's actually very interesting is anybody who shows up to an emergency room,
Mm.
regardless of ability to pay, has to be taken care of, right? Let's say you come to the emergency room, you are extremely poor, you have no money, you have
Mm.
very bad clothing. I mean, somebody looks at you and they know that you live on the street, right?
Before I had even emergency room, the doctor or
Mhm.
nurse or a hospital staff, they ask the patient, do you have a credit card?
Yeah, I mean, the thing is, it is very common in America when you go to a clinic, when you go to the doctor's office, the first thing, if it's your first time at that office and they don't know you, they will ask you, what is your insurance?
Mm.
Do you have insurance, and what is your insurance? And almost everybody has to have insurance because otherwise the payments are ridiculous.
Mm.
Healthcare is extremely expensive, right? If you go to just a dentist's office,
Mm.
just a cleaning is maybe $300,
Mm.
right? You have nothing wrong with your mouth, just a
For
cleaning.
example, someone had crashed by the car accident, then they brought in the hospital. If they don't have many money,
Hmm.
how hospital treat them?
So that's the situation where it's an emergency, right?
Mm.
If the patient is in the emergency room or there is a threat to life at that point, if the person is not treated, then he will die. Then
Mm.
the hospital staff and the doctors and the nurses have to take care of the patient, right?
Mm.
But now the problem is this is the rule of the they call it EMTALA, I think, the emergency room or something. Uh, I read about this when I was studying this stuff. Emergency Medical Treatment and Labor Act.
Mm.
Emergency Medical Treatment and Labor Act, EMTALA. EMTALA says that if anybody comes to the emergency room, doesn't matter how poor they are, doesn't matter if they are old, young, sick, half dead, homeless, then the emergency room or the hospital people
Mm.
have to stabilize the patient.
Mm. Yes, yes,
They have to
definitely
stabilize the
like
patient.
that.
Yeah.
Anyway, at first they treat the patient.
Uh-huh.
Then
Absolutely.
insurance or money is the another story.
Mm-hmm. Exactly, exactly. But let's say you come into the emergency room and it's not a life-threatening situation, right?
Mm.
Let's say you're at the emergency room and you're complaining that you have a headache.
Yeah.
That's not something that they will necessarily immediately consider as life-threatening, right?
Mm.
So yeah, definitely EMTALA and the rules surrounding EMTALA mandate that as long as you have extremely dire circumstances or it's a life and death situation, then they have to stabilize you, and then regardless of your ability to pay, right?
Mm.
Regardless of whether or not you can afford it or not.
We
So
have national insurance, so we don't have any such concern.
yeah, but the national insurance thing is it's not a very it's not something that Americans are used to, and I think whenever government control over a new area is even suggested in America, it
Mm.
leads to a lot of opposition from some groups.
Mm.
Uh, Many Americans, for example, my dad, he is in this group as well. He believes that the government should not interfere in the personal lives too much of the people.
Mm.
Right. I have my money, I have my house, I have my car, I have my life, I pay taxes, I'm not a bad person, I'm not breaking the law. The government should leave me alone,
In
right?
Germany, the case is more advanced. For example,
Yeah.
my sister sometimes need to go to the hospital. It's all completely free.
Hmm.
Everybody pay a lot of tax, only tax.
That's the thing. Taxes, to tell an American that you have to pay taxes, more taxes, because there are poor people in the country that might need your help, or just not even that. Just saying you have to pay more taxes will destroy your reputation as a politician here,
Yeah.
right? Taxes are extremely loathed, hated by everybody here, right? Increased taxes is one of the worst ways to regulate, anything in the U.S., right? Income tax, state tax, property tax, sales tax. I mean, there are taxes of every kind. My salary, they took a third of my salary for taxes,
Yeah.
right? One third. And it was because I don't have a wife, I don't have children, so they saw my salary, they said, this guy doesn't need this much money. We'll take one third of his money, right? I mean, it's a lot of money. Like I worked for that money, right? So
But you are living in America. You had a lot of benefits compared to other countries.
exactly. But only people that understand that stuff are not angry, right? Some people, and many people don't even want to understand that stuff, right? For them, it's like with my father, right? Their money, they worked hard, they should keep it, right?
Yeah.
If people need help, okay, yeah, we can have different programs, but it should not be based on taxes. It should not be based on increased government control. I mean, a lot of people. I mean, the government is a government. The government makes mistakes. They are very slow, bureaucratic, corrupt. People. Some of them are very corrupt. Others are maybe good, but it doesn't inspire confidence in the American people if the government says, let's do this, this will help us. We are suspicious of the government when it comes to big programs and giving, asking for billions and billions and billions of dollars for something that may not be in the best interest of everybody. We are not happy with things like that, right? Yeah.
All countries, the people doubting the government. How
Yeah.
how are you using my money like that?
Exactly. Even more so here. And here there are so many other debates about, you know, because we have the separation between the federal government and then the state government and then the local government. So the city versus the state versus the country. And there are a lot of people who are, you know, they take pride in their local government, okay? Like, if something happened in my town right here, right now, right, that would affect me more than something happening in Washington, right? So a lot of people are very understanding. Okay, my city, my school, the school here on my street where, young children in my community are going, of course, I will pay more money for that school because they live in my neighborhood, they're my neighbors, they're my people. But why should I care about some problem in California or some other state where, they need money and now the government is saying everybody needs to help that state, right? If it's a financial thing, people don't care. If it's a natural disaster, of course, everybody cares, right? If there's a flood, if there's an earthquake, then the entire country unites, for those kinds of things. But yeah. Anyway, Heidi, great conversation. We're going to talk a lot more about that healthcare stuff. Let me very quickly just say hi to Eka. How's it going, Eka?
I just got up
I know,
and
right?
and today is my holiday in Thailand. So it was a birth of King Ramanai, which was the grandfather of the current king in Thailand. So my company has a holiday today, so I don't have to go to work.
Mm-hmm. That's awesome. The current king of Thailand, Eka, he was born in the U.S., right?
Oh, yes, that's right.
Yeah.
But to be honest, I haven't heard him speak English.
Really?
Yeah,
Yeah, King
may
Adulyadej, right?
yes, King Duyodej. Yeah,
Uh-huh.
I guess he must speak fluent English, but he may use English only he need to talk to diplomat from other countries.
Uh-huh. Yeah, possibly, right? He was born in Cambridge, Massachusetts.
Yes.
I lived very close to Cambridge when I was younger. Um,
Uh,
but yeah, it's very interesting. I'm sure he speaks very good English because his father was studied at Harvard, and he also was, he's a very dedicated, smart king. I feel like he's very popular. I think, right?
Yes, that's right. I would say most Thai respect him, and he usually does things that good for Thai people.
hmm That's really good. That's really good. Most countries, honestly, like countries that have kings or countries that have, you know, um, different kinds of monarchies, right? There is a lot of opposition to monarchy. It's considered maybe more traditional, not modern, but uh, it's interesting with Thailand because you guys are a constitutional monarchy. So even though there is a king, you guys also have a parliament and things like that. So
Yeah.
that's good. That's good. So is it a holiday for everybody or just for your company or for other
It
companies like that?
uh, is a holiday for everybody,
Uh-huh.
uh, unless you are working at a shopping mall, so you have to go to work.
Yeah, right. Because on the holidays, everybody who's not working is shopping.
Yes, that's
All
right.
right. Fantastic. Nothing is different between here and there, man. Here, every day or we have a phrase in English that we say, um, every holiday is man, I'm forgetting the phrase. It's something like every holiday is a commercial event, or we have all of these events. Like, Americans are so crazy about holidays that they make fake holidays just so people can go shopping.
Okay.
Like for example, there's one fake holiday called Christmas in July.
Christmas in July.
Yeah, Christmas is normally in December, right?
Yeah,
And
that's
everybody in the world celebrates, or everybody in America, it doesn't matter if you celebrate Christmas or don't celebrate Christmas, we all shop for Christmas, right? So just in 1 month, they will be selling everything. Thanksgiving is in November, Christmas is in December. So every shop, every store, every person in America will be thinking about shopping and gifts. But consider just 6 months prior to that, right? 6 months before December, we have June and July, and it's a very slow time for the shopping malls. So they have a fake holiday called Christmas in July, where they sell. I mean, it's another event where they sell a lot of things and big shopping time for a lot of people.
and for Christmas in July, does the shopping malls all say that, oh, today is Christmas in July without a real reason that related to something else?
So yeah, they don't. There's actually no specific day. I think every shopping mall they use maybe a different time in July, or maybe they agree that the second week in July or the third week in July we will make Christmas in July week or something like that. Um, and they do advertise it as Christmas in July, uh, but nobody knows. At least I don't know what the reasoning for that is. Um, One possible reason is that in the southern hemisphere, winter is in July, so maybe because they are celebrating winter, or they are in winter time, maybe we want to celebrate the winter there during our summer here in the northern hemisphere. But I'm honestly not sure. But it is something that is a very commercial holiday, very fake, just a time for people to go shopping.
And do you usually go to shopping in Christmas in July?
No, no, I don't. I watch what the other people are doing, and I laugh at them.
Yeah.
But I definitely will go shopping for Thanksgiving and for normal Christmas because have you guys heard of something called Black Friday? It happens in the
Yeah.
US. Uh-huh.
Yeah, I have heard that I think it was last year there were so crowds of people, and then uh, when the mall all open, people stepped on each other and some people died.
Yeah, people die every year. Some people. So this is what happened when I was 16. 16 is the earliest age that you can drive. So I remember I got my license. I got my license to drive when I was 16 in May 12, 2005. I'll never forget that day. Okay, I became a free man on May 12, 2005. So I turned 16, and just a few months later, or not a few months, but maybe 7 months later, it was time for November, December shopping, right? So Black Friday is the day after Thanksgiving. So it's the last Friday of November usually. And every single shopping mall, shopping store, center, anything, they give doorbuster sales. Okay, we call this is American English, doorbuster, which means you need to break the door open to get inside. This sale is so good, right? Or these deals that they're offering, what they're selling, everything is so good and the prices are so low. You have to break the door to actually go into the store, right? So people stand in line from midnight the day before, right? So Thursday night, everybody has their meal because it's Thanksgiving. 10 o'clock, 11 o'clock p.m., they go and they wait outside at night in front of the store.
Okay.
But the store will open 7 a.m. next morning. So they're waiting for 8 hours, 9 hours to be the first people to enter the store, right? So I remember I didn't do that because I'm not crazy, but I came to the store at maybe 6 o'clock in the morning, and the door was going to open at 6:30, right? There was a big parking lot. Almost all of the cars were already parked. There were no spaces, right? And I saw an empty space, and I was thinking, okay, I'm going to grab that space. So I'm driving up, and I almost get there. This other car comes from the other direction, right? Honks me, like, if you take that space, I will kill you, right? Do not take that space, right? One last space remaining. That guy, he drives like a crazy guy, and he parks his car right in front of me. If it was any other normal day, I would have been able to take the spot, but not on Black Friday. Last year, someone in Chicago, because he took someone else's spot, the other guy took a gun and killed him.
Oh,
right?
that's
They have
bad.
guns, because people have guns in their car, right? So this guy had a gun, and he killed the other guy that took his spot.
Oh, yeah.
Or what he thought was his spot. His name isn't written on it, right? But he thought it was his spot, and why did the other guy take it? So he got killed. He shot the other guy, right?
Oh, okay.
People are crazy, So, you know what I do now? I don't even go outside. I just buy everything online on Black Friday.
Yeah. I think many people are so crazy about their life.
Yeah, they are. They don't care, and it's to buy garbage things, like maybe you buy a toaster for $5, right?
Okay.
When do I need a toaster? The other 11 months of the year, I don't have any need for a toaster, but no, it's $5 toaster, I must get it, right? Or maybe a gift or something like that, right? But they do give a lot of good electronics deals, a lot of computers, a lot of laptops, and those are the things that people get trampled and killed for, right? Maybe they'll give an iPhone for like $200. People will go crazy for that, right? Or a very nice laptop for $300 or $250, right? Usually maybe it's $700, $800. People go crazy for those kinds of deals, right? And they do kill people. They do kill people. Every year somebody dies.
Yeah, and I agree with you that I would prefer to buy cheap things online on Black Friday.
Yeah. The online deals are even easier because you just sit at your computer, I'm already super full from eating all the Thanksgiving food. Just sit at my computer, go online, open what I want to open, and just order what I want to order, right?
Yes.
It makes a lot more sense. Anyway,
Yeah.
guys, so I'm glad you guys are the only people in the class. We talked about, with Heidi, we were talking about hospitals, and now with Eka, we talked about all the shopping craziness that happens, right? So anyway, guys, let's get back on track. So today's lesson, we're going to be talking about the idea of personal pronouns, right? So, I'm sorry, possessive pronouns, excuse me. So, possessive pronouns, guys, are based on three things, okay? Three main criteria for possessive pronouns. First of all, what are the possessive pronouns? So, what's the possessive pronoun for I, Heidi?
I, first person.
Yep, first person. So what would be the possessive pronoun?
A possessive, my.
Pronoun though, right? Not possessive adjective.
Mine.
Mine, right? Exactly. So the possessive pronoun for I is mine, right? What about, Eka, what about for you? The possessive pronoun for you.
You.
Well, okay. Let's actually review then, guys. Let's actually review. So let's take a look at this. So, for example, possessive pronouns are based on three things, right? The first thing that they're based on is the gender, right? The gender of the person that we're talking about, right? So, for example, if it's a male, we can say the computer is his, right? The computer is his, right? So, what is the difference between possessive pronouns so this is the first thing that we look at, right? We look at the gender. We can say if it's a girl, what would we say if it's a girl? Eka, instead of saying the dog is his, what will we say? The dog is...
The dog is her.
It's not going to be her, right? Because her is a possessive adjective. Hers, exactly, right?
Hers.
Because we're talking about possessive pronouns, right? These possessive pronouns are actually going to be... It's going to be hers for a girl, right? So the dog is his, the dog is hers. What about if the dog belongs to you, right? Or belongs to yeah, right? So if you would say, for example, if you're telling somebody the computer is yours.
Yours.
Right? The computer is yours, right? So these are the possessive pronouns, right? The interesting thing about possessive pronouns is that they come after the noun that we are talking about, right? So that's the difference, Eka, with possessive adjectives, they come before the noun, right? So this is her computer, right? That's a possessive adjective. Possessive pronoun, it has to come after the noun, so it will be this computer is hers, right? That's the difference. So the noun is computer, right? Possessive adjective, this is her computer. Her comes before the noun, comes before computer. But in possessive pronouns, the pronoun comes after the noun. So this computer is hers, right? That's the difference when it comes to adjective versus pronoun, and it's a change that is initially confusing, definitely. So the dog is his, the computer is hers, right? How would we say, what is the possessive pronoun for? Okay, so for you, we read that it is yours, right? Yours, fantastic. What about for it? It would be its, right? So the computer is, well, we don't actually use its a lot in possessive pronoun, but just to know what it is, it would be its, right? What about we looked at his, right? What would be the possessive pronoun for his? Or for he, I'm sorry, for he, it's his, right?
You just said it.
I already said it, yeah. It was for he, it's supposed to be his, right? What about for she?
Hers.
Hers, right? So it's really, really, really important, guys, that you pronounce that last S, right? We need to be able to hear that last S. His, hers, right? Hers. It's kind of funny sometimes when I say it because I'm saying it loud or I'm saying it slowly. But yeah, the computer is hers, right? Really have to say the S at the end, right? So he is his, she is hers. What about, so it is its, right? What about for we?
Ours.
Ours, right? Ours. So How can we make a sentence with that? Eka, how could you make a sentence with ours? Remember, the possessive pronoun has to come after the noun.
This lesson is ours.
This lesson is ours. Fantastic, right? This lesson is ours. And what would be the possessive adjective form?
This is our lesson.
Fantastic. This is our lesson, right? So notice how the possessive adjective doesn't have the S, but the possessive pronoun has the S. So it's ours, right? Ours.
Yes.
It's fantastic. And then what about for they? What's the possessive pronoun for they?
Them.
Theirs.
It's not going to be them, right?
Theirs.
It's going to be theirs, right? Theirs. So they
Theirs.
becomes theirs. Notice how all of these examples have an S at the end, right? All of these possessive pronouns, except for mine, has an S at the end, right? So you is yours, he is his, she is hers. It, we don't really use, but whatever. You know, we is ours, you is yours, once again, if it's more than one person, and they is theirs, right? So let's take a look at this in terms of some examples, right? So the first thing that these possessive pronouns are based on, like we said, is gender. If it's a girl, then we use
Hers.
hers, right? If it's a guy, then we use his. Fantastic. Then the second thing that they're based on, the first one was gender. The second thing that they're based on is if it's first person, second person, or third person, right? So first thing is gender. Second thing is first, second, third person, right? So what is the first person possessive pronoun?
Mine.
Mine, right? And Eka, what's the second person possessive pronoun?
Yours.
Yours, right? Fantastic. It can either be plural yours or it could be singular yours, right? If you're talking to one person versus talking to a lot of people, right? And Heidi, what are the third person possessive pronouns?
Singular.
Third person singular. Yes.
Singular. 3 patterns.
Uh-huh.
Singular. His, hers, it.
Exactly, right?
That.
And what about if it's a third person plural? Theirs, right? And Eka, what is the first person plural possessive pronoun? Ours, right? Ours. Fantastic. So you guys already jumped the gun, and the third category that they're based on is if it's plural or singular, right? So the first is the gender, second is either first, second, or third person, and the third category is plural versus singular, right? So that's how we know which possessive pronouns we want to use. And the one interesting thing to keep in mind also with possessive pronouns is they can be the subject of the sentence or they can be the object of the sentence, right? It doesn't matter. You can say, for example, if you're talking to somebody about their let's say they made some really delicious dessert, right? So these desserts, or you could actually, it'd be better to say these desserts of yours are the best, right? These desserts of yours are the best, or just yours are the best, or yours are the most delicious, right? In that case, that yours is the subject of the sentence, right? Exactly. And you can also say, for example, let's say you're still talking about these desserts. Heidi really liked ours, right? Or Heidi or Eka really enjoyed theirs, right? Their desserts. And in that case, it's the object, right? So you can either make the possessive pronoun the subject of the sentence or the object of the sentence. It doesn't really matter, right?
I have a question.
Yeah.
If I say I like yours, does it confusing person I'm talking to for which object I am talking to? I like yours. Is it your shirt or is it your dessert?
If you say I like yours, right, then you have to be, it depends on the context, right? So let's say you are talking about dessert. Yeah, in that case you would it would make sense, like, let's say you're going around all these different desserts on different tables, right? Each person who made their own dessert is in front of their dessert, right? So each person is standing at the dessert that he or she made. You try one and you say, oh, I really like yours, right?
Okay.
In that case, it would make perfect sense that you're talking about the dessert, right? It depends on the context, yeah. Just by saying I like yours, we won't know what you're talking about, right?
Oh.
It depends on what we're saying. So if it's shirt, if it's dessert, if it's hairstyle, whatever, I really like yours, right? I really like this hairstyle of yours, right?
Oh.
That's a very common way we say. We put an of between the noun and the possessive pronoun. And we can say, I really love this dessert of yours. Or, I really love this shirt of yours, right? It's a little bit more confusing because normally, the native speakers would just say, I really like your shirt,
Oh,
right?
yeah.
And that would be the possessive adjective, right? Instead of the possessive pronoun. But if you want to use the possessive pronoun and you also want to explicitly describe what you are going to be, like talking about, then you would want to use the of, right? This shirt of yours, this dessert of yours. But it doesn't sound as natural to do it that way.
And does it mean that possessive adjective is more commonly used in daily conversation than possessive pronouns?
Absolutely. Absolutely.
Okay.
Yeah. Possessive pronouns are used when you understand what is being talked about, right? You're at a place and people are talking about people's different things, right? Let's say all these students have all these different types of computers. Oh, I really like his, right? I really like hers, right? This computer is his, and I really like it, right? Those are the ways that we use possessive pronouns. Really depends on the context of what we're talking about, right?
Oh.
But with possessive adjectives, you can just introduce whatever, right? I really like your computer. I really like his computer, and it's the adjective is always coming before the noun, right? With the pronouns, they're always coming after the noun.
Okay.
Does that make sense?
Yes, it makes sense.
Okay, fantastic. Any other questions, guys? If not, we're going to jump into our article. Heidi?
No question.
Okay, fantastic. Eka, you're okay as well?
Yes, I have no question.
Okay, fantastic. So let us get started, and I'm going to. So today, the class is a little bit. It is about healthcare. So the article that I chose is with regards to the HPV vaccine, right? So the HPV vaccine, the human papilloma virus, is a virus that affects people when they are, I think, sexually active, if I'm not mistaken. So the HPV virus is something that a lot of, it's not the same thing as the herpes or HIV, but it is a sexually transmitted disease, right? And we see it a lot in people who are maybe sexually active, but there is a vaccine that is used to, prevent this kind of disease in people. However, recently, less and less, or fewer and fewer people have been getting vaccinated for this disease, right, or for this viral disease. So let us take a look, and we will see why the reason is that we have so few people doing this, or less people than before doing this, right? So language barriers, as well as safety concerns, may be slowing HPV vaccination rates. Only about a third of parents get children vaccinated for HPV, lagging behind the goal of 90% coverage by 2020. While a vaccine has existed for the human papillomavirus, the most commonly sexually transmitted disease in the United States, for 7 years, researchers and public health officials are trying to figure out why fewer than 1/3 of parents are getting it for their children. The first HPV vaccine, which entails 3 shots over 6 months and protects against the 4 most common strains of the virus, was approved by the FDA in 2006 and is recommended for girls and women between the ages of 9 and 26. But while 2 different vaccines are now available, researchers have been frustrated with how few young girls are getting protection from the virus, which can cause genital warts and cervical and other cancers. Studies suggest that parents' reasons for not getting their children vaccinated include language barriers, concerns over vaccine safety, and speculation that the vaccine would lead to promiscuity. What is promiscuity, guys?
I don't know.
It's a hard word, definitely. Heidi, do you happen to know?
Promiscuity. Promise at first on the what?
Promiscuity is when somebody is. Go ahead, Heidi. I'm sorry.
Something confusing or complicated.
No. So promiscuity actually means if somebody is sexually, I guess, attached, or if somebody is promiscuous, that's the adjective we hear. A promiscuous person is somebody who openly is looking for a sexual relationship, or is very free when it comes to sexual encounters and getting into those kinds of situations.
Complicated relationship?
Not necessarily complicated. No, it actually implies that you are, like if a girl is trying to attract men, that she wants to have a relationship with, maybe she wears very, revealing clothing. Maybe she's, always hanging out at bars and trying to meet men, right? That would be a promiscuous person, somebody who is interested in sexual relationships, not just confusing ones, but actual sexual ones, right? So parents are not getting their children this vaccine, right? And the reason is they think that because of language barriers, right? Concerns over safety and speculation that the vaccine would lead to promiscuity, right? So parents are thinking, if my daughter gets this virus, maybe she will think that she is protected from HPV, right? And as a result, she'll be more free to. She might think, oh, okay, now I can have as many relationships as I want because I have this vaccine, right? So this is an important part of the article. But doctors are saying having a vaccine isn't always enough. Delivering that vaccine is critical, and in the United States, our delivery rates have been lower than what most of us hoped they would be, said Dr. Larry Pickering, an associate professor of pediatrics at Emory University School of Medicine, at a press conference Friday in San Francisco, part of a meeting of many of the nation's leading experts on infectious diseases, right? In several studies presented this week, researchers discussed low rates of HPV vaccination in the United States. Pickering said only 20 to 30% of girls get all 3 shots in the series, but as researchers investigate, they find there is no single reason why rates of HPV vaccination in the U.S. lag far behind the goal of 90% coverage by 2020. You can't assume the reasons that a parent would not want to have their child immunized, because there are 5 or 6 different reasons, Pickering told Al Jazeera. So the rest of this article is actually very, very busy, but what I wanted to kind of touch on was that this last part right here. So Pickering, this doctor, said that one reason this may occur is that pediatricians are pressed for time with the need to discuss many health issues, and they ultimately do not see cases of cervical cancer, which occurs in older women, with a result similar to the way vaccination rates for measles may have dropped slightly because younger pediatricians have never seen that disease. Okay, this last part is confusing. Don't worry about that, guys. But they are saying one reason that the pediatricians, that the child doctors may not even think about this vaccine is that they're pressed for time. What does that mean if somebody's pressed for time? Do you guys know?
I can't find. Where?
Oh, this one right here. If you see my screen, I think it's highlighted. It's in it's in the 5th to last paragraph. Maybe if I do it this way. You guys can see my screen, right?
Yes, I can.
Just
Does it mean that the doctor suggests the parent to wait until a certain age, maybe until 9 or 10 before injecting this vaccine to the kid?
No, I think there definitely is an age limit or an age requirement. But in this case, if we say that a pediatrician is pressed for time, that means, or if somebody is pressed for time, that means that they don't have enough time, that they are running out of time, right?
Oh,
So if somebody says I am pressed for time, it's another way of them saying I don't have enough time, right? I have no time to do what you want me to do. I'm pressed for time, right? So, doctors are responsible in many ways to help their patients get vaccinations, right? And in this example, they're saying pediatricians, doctors for children, are pressed for time. They have the need to discuss many health issues, and ultimately they don't see cervical cancer cases, which happens in older women. They don't see it in their children, right? So but there are other mistaken beliefs that must be countered, Pickering said. For example, while parents may be worried about promiscuity, 3 studies have shown that getting the vaccine has no effect on promiscuity, right? Ultimately, he said the benefits need to be spelled out better, right? People need to know why this vaccine is important. Uh, while many parents may be uncomfortable with vaccinating their daughters for an STD at the ages of 9 to 11, the period recommended for starting the 3-shot series, tests on recipients have shown that in addition to protecting girls from HPV infection earlier, getting the shot at a younger age provokes a stronger immune response. So a girl vaccinated at 11 is better protected in the long run than a girl vaccinated later on, right? So that's an important scientific thing to also keep in mind. And in addition, very last thing this doctor says is the younger you get it, the better the immune response. Let's go ahead and give it, and that's one thing you don't have to worry about, right? So looking at what they're discussing in this article, guys, yeah, fantastic. Eka, you wrote down a lot of these definitions. I didn't notice it in the window, right? What's your reaction to this story, Eka? Why do you think, or what do you make of this vaccine that people are not giving their children? Lowest rates. We wanted 90% of children by 2020. We're seeing just 30%, and we have 7 years to reach our goal.
yeah. I have read about this vaccine 2 or 3 years ago,
Uh-huh.
and I I have read that it has some side effect for older people,
Mm-hmm.
and if it 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 may cause some cancer as well from the side effect. So I guess some people may not sure if the vaccine is good enough for their health, and the side effect of having cancer is quite high. So I think they may not want to take risks.
Mm-hmm. So that really, I guess, then that makes it something that, maybe these parents have a good reason to not give this vaccine to their daughters or to their
This,
family members.
this vaccine is
Yeah.
to prevent some illness came from the kind of sex, right?
Yeah, it's
So
just so it prevents that, yeah.
so if the girls had this vaccine, they had confidence I don't get any illness from that. Then parents worry about their activity.
Exactly. That's where the question of promiscuity came up, right? Parents
Yes,
are worried that their kids will be that their daughters in this case will be more promiscuous if they
yes.
get this vaccine. But they did say that they did 3 different studies and the vaccine had no effect on promiscuity.
But if the girl is miscarriage or not is a kind of characteristic, not related to vaccination.
Uh-huh.
A little
But
related. But if the girls enjoy their life with many boyfriends, it's a
uh-huh.
characteristic, right?
Yeah, that is true, but maybe somebody, what if the girl is relatively normal, but then she gets this vaccine and social pressures, middle school, high school, now she has this vaccine and she's thinking, okay, maybe before I was less curious, now I'm more curious. And they start doing these things, right? I guess, I mean, it depends person to person, right?
Yes,
And
that's right.
and and parents know their children, maybe, or they think they know their children, right? That's, I think, where some of this is, some of that hinges upon. What do you think, Eka, about the whole argument about these girls having more promiscuity?
I don't see the correlation between giving vaccine and peer promiscuity.
Mm-hmm.
I think promiscuity is just their personal choices. It doesn't matter if they have this vaccine when they were young or not.
Yeah, it depends really. And I mean, honestly, like if I was a parent, I wouldn't even tell my daughter what this vaccine was for.
Huh.
I would just say it's a vaccine you needed for something. If she's 9 years old, she's not gonna care.
Huh.
You know what I mean? So I think parents can also be creative about it. I mean, if they want to know, if the child has a right to know, of course, I can tell my child, this is going to stop a very bad disease. You need it. Okay?
Huh.
That's it. I mean, if she ever asks me when she's 16, hey, did I ever get the HPV vaccine? I can tell her, yes, you did when you were younger, right? But I need to also make sure that I mean, I wouldn't want my daughter to be promiscuous, right? So it depends on good parenting and good, social framework, good understanding, right? Um, those kinds of things, I guess. But I don't have any daughters, guys, just in case you were wondering. I have no, I have no kids.
Not a miscarriage. Only she had a boyfriend, but if she got infected, that time infected, only boyfriend had some illness. And only one boyfriend, she got infected.
Yeah, but
So,
how often do we see young people with only one partner?
but even the miscarriage girls, if they are lucky, they can get any infection. So,
Hmm.
even the case, and
That's the thing, right? It really depends a lot on I think on individual tastes and stuff like that. But what do you guys think about the language barrier question? How could that be an issue? Like, how could a language barrier keep people from
yeah,
understanding the value of a vaccine?
I wondered about that when I read this article. Why?
Yeah, so I might have skipped that part, guys, because it was. Go ahead, yeah, go ahead.
I think the language barrier in this case might mean the some technical words that are related to to this this vaccine might not be understood by most people.
Mm-hmm.
For example, in Thailand, if a doctor write down a drug prescription, I would not be able to understand what are those drugs.
Mm-hmm.
Yeah.
Absolutely
So
right.
I think the doctors or the hospitals might need to rewrite the advertisement and makes it more easily to understand by average people.
Absolutely, absolutely. You can be fluent in a language. It could be your native language, but if you look at technical, medical, vocabulary, or if you look at maybe legal vocabulary, it can be difficult for anybody, right?
Yes.
So that's a big part of it, the language barrier. In this case, I think that is definitely part of it, but there's also another issue, and it was mentioned very briefly in the article when I skipped it over, and that deals with the fact that there are a lot of Spanish language speakers in the United States. And there is a concern that there was a language barrier because a lot of these Spanish-speaking people who don't speak English just did not have the information for HPV vaccines available in their language, right? So maybe they go and visit the doctor and they see, you know, their doctor informs them about anything else that they might need, a lot of different things that they might need, and there are Spanish language brochures, information for those diseases, but not not for HPV stuff as much, right? So that leads to a problem. Does that ever occur in your countries, guys? Like maybe minority populations have less access to care or less understanding of certain things because everything is in Thai or everything is in Japanese?
Japanese case, yeah. If
Yeah.
we can speak Japanese. Sometimes foreigners living in Japan. That's the case, I don't know.
Uh-huh. So even if I were to go into maybe a clinic in Japan, would all the information, prescription, everything be in Japanese?
Yes.
Wow.
I'm sorry.
That's fine. But I mean, maybe the doctor speaks English, right?
No, it's a rare case.
Really?
Yeah. They learn English, so maybe they write English, because they can't speak English.
Wow. Is it the same in Thailand, Eka?
It depends on which hospital you go to. If you go to a public hospital, so it's unlikely the doctor can speak English.
Mm-hmm.
But if you go to a private hospital in Thailand, so most doctors can speak English, and most of them are graduated from the US or from the UK, so they speak fluent English.
Mm-hmm.
And I have heard that many people from the US fly from the US to Thailand to do the operation because it's a lot cheaper here.
Absolutely. Do you know what that's called? What we call that here, Eka?
No, I don't.
Medical tourism.
Okay, medical tourism.
Yeah, medical tourism is extremely. It's a new thing. I think one day I'm gonna write or not write, but do a class about this.
Particularly in India.
Oh, India is crazy.
Yes.
Yeah, and they also go to Singapore. A lot of Americans are going to Singapore, India, Thailand. China also is now becoming a new location.
I heard in India there are many good doctors. They learn medical care in America, then return to India.
You know, if that's the situation, and Eka, I think this would be the same in Thailand. If a American or British, French, whatever educated doctor goes back to their native country, they become very rich very quickly, right?
Yes, that's right.
Yeah, they work for these private hospitals. They can charge a lot of money. Rich people go to their hospitals, or foreigners come to their hospitals, and they make a lot of money. Yeah, and they make more money than they would make in the United States with all this insurance stuff.
I don't think so. Because a doctor who works in a private hospital in Thailand earned maybe from 10 to 15,000 US dollars per month.
Yeah, $10,000 to $15,000 a month is really good.
Ah.
Yeah, I mean, in the
Okay.
US, if you're a specialist and you have your own clinic, then you are probably making. So if you have both of those qualifications, right? If you're a specialist and you have your own clinic, then you're maybe making $50,000 to $75,000 a month.
And rich people can buy some organ.
Yeah, rich people can.
Yeah. Mm.
Yeah, but I mean, if you're a normal doctor, like if you're not a specialist, and if you go back to Thailand or India or whatever, wherever you're from, you can make a lot more money in your native country than in the U.S. I would imagine. But if you're a specialist in the U.S., then there's no limit. I mean, I know specialists in like my family knows specialists who are making $1 million a year.
Oh, that's a lot.
Easily $1 million a year. Some of them, if you're a heart surgeon, maybe you're making $3.5–4 million a year.
Oh.
Yeah.
Before I saw the picture, some Indian village, they have only the same scar on their belly. It's after removed the kidney.
Oh, because people steal their organs, right?
Yes.
Yeah,
They,
but I
they
mean,
sold the organ. So
yeah, that's
the
really bad though.
villagers had the same scar on their belly.
That's really bad. Organ trafficking, I would say,
Yes,
right?
yes,
It's a
yes.
very difficult situation, guys.
Mm.
Organ, yeah. So for example, your heart, liver, lungs, people steal those body parts.
Oh no, I mean the word organ trafficking.
Organ trafficking, yeah.
Traffic.
Trafficking means to sell or buy something illegally, right? So for example, drug trafficking, uh, human trafficking, people sell and buy humans also. So that's,
Okay.
yeah, this would be organ trafficking. Yeah. Um, Guys, it was a great class. Did anybody did you guys have any questions about what we talked about with personal pronouns or in this article learning about HPV vaccines and
No,
medicine? Everything's
No.
good? Eka, any questions?
Yes, I have one last question.
Sure,
then
sure.
thank you very much. Goodbye.
Yeah, Heidi, take care. Goodbye. Yeah.
For this class, if I say our class is almost finished, and if I want to say it in possessive pronouns, how could I say it?
This class of ours is almost finished.
This class of ours is almost finished. Okay.
Absolutely. Yeah. Because in that case, ours is coming after the noun, right? So that'd be the possessive pronoun, and it's coming after the noun, and you have of in between. So this class of ours is finishing now.
Okay, all right.
Yeah,
Thank you.
absolutely, Eka. Have a great rest of the night, or rest of
Yeah,
the day, I should say. And
yeah,
yeah, I hope to see you soon.
sure. You have a great evening, and I will see you in our next lessons.
Awesome. Take care, Eka.
Thank you. Bye.
Bye-bye. Studying this stuff. Emergency Medical Treatment and Labor Act.
Mm.
Emergency Medical Treatment and Labor Act, EMTALA. EMTALA says that if anybody comes to the emergency room, doesn't matter how poor they are, doesn't matter if they are old, young, sick, half dead, homeless, then the emergency room or the hospital people have to stabilize the patient.
Yes, yes.
They have
Japan
to stabilize
is
the
like
patient.
that.
Yeah.
Anyway, at first they treat the patient.
Uh-huh.
Then
Absolutely.
insurance or money is the another story.
Mm-hmm. Exactly. But let's say you come into the emergency room and it's not a life-threatening situation, right? Let's say you're at the emergency room and you're complaining that you have a headache.
Yeah.
That's not something that they will necessarily immediately consider as life-threatening, right? So yeah, definitely EMTALA and the rules surrounding EMTALA mandate that, as long as you have extremely dire circumstances or it's a life and death situation, then they have to stabilize you, and then regardless of your ability to pay, right? Regardless of whether or not you can afford it or not. So
We have national insurance, so we don't have any such concern.
yeah, but the national insurance thing is it's not it's not something that Americans are used to, and I think whenever government control over a new area is even suggested in America, it leads to a lot of opposition from some groups. Uh, Many Americans, for example, my dad, he is in this group as well. He believes that the government, regardless of ability to pay, has to be taken care of, right? Let's say you come to the emergency room, you are extremely poor, you have no money, you have very bad clothing. I mean, somebody looks at you and they know that that you live on the street, right?
Before I had even emergency, that doctor or nurse or hospital staff, they ask the patient, "Do you have a credit card?"
Yeah, I mean, the thing is, it is very common in America when you go to a clinic, when you go to the doctor's office, the first thing, if it's your first time at that office and they don't know you, they will ask you, what is your insurance? Do you have insurance, and what is your insurance? and almost everybody has to have insurance because otherwise the payments are ridiculous. You know, healthcare is extremely expensive, right? If you go to just a dentist's office, just a cleaning is maybe $300, right? You have nothing wrong with your mouth, just a
For
cleaning.
example, someone had crashed by the car accident, then they brought in the hospital. If they don't have many money, how hospital treat them?
So that's the situation where it's an emergency, right? If the patient is in the emergency room or there is a threat to life at that point, if the person is not treated, then he will die. Then the hospital staff and the doctors and the nurses have to take care of the patient, right? But now the problem is with this is the rule of the they call it EMTALA, I think, the emergency room or something. I read about this when I was. Should people be obligated to have health insurance, and should the government supply part of that health insurance or provide for that health insurance?
It's kind of donation.
Yeah.
Rich people can pay the money, but the poor people can't. Then poor people, when they got injured or illness, they can't go to the doctor if the payment is very high. So rich people need to pay the money.
Yeah. No, absolutely. Rich people pay the money, and I mean it's something that I think the debate in the United States is nobody should be forced to have health insurance. Like one of the people who, or not one of the people, but I guess the group that is against the national model or this increased access to healthcare, their argument is nobody should be forced to have healthcare. It should still be something that is a personal choice.
But if your payment to go to the poor people, they can access the hospital, and even they're giving birth. Even poor people give the birth. They need to go to the hospital for their kids. Their babies have no responsibility about their situation. Why a poor baby need to die without going to the doctor, right?
Yeah, no, absolutely. That's with babies. Actually, everybody is very sympathetic. There is no debate, right? So young children, as well as infants and babies, they are covered by government, protection, government laws. And then the other aspect of U.S. law that's actually very interesting is anybody who shows up to an emergency room.
I've just come back from the clinic.
What did the doctor say?
It takes at least additional 2 weeks.
Oh, another 2 weeks?
Yes.
Well, it's something to look forward to, I guess, right?
Yeah. Yesterday I went to the coffee shop. Before I went to the place twice or 3 times a week. But after getting injured, it was the first time to there. In these 4 weeks, she was worried about me. What happened? Then I went there. I'm sorry I couldn't come here because my face was covered by bruise or clot, a lot of things. Then she said, "Are you okay?" Yes, now okay. My arm is not so much painful.
Yeah. So you see a lot of different types of folks that come to the clinic, right?
Yes.
Is it a larger clinic or just a
very small clinic?
Just like a kind of like a community clinic, right?
Yes.
People come in and they there's probably a few doctors, maybe a few nurses, right?
Yeah, that's right.
Nice. That's good. Here, honestly, most of the clinical settings that I've seen are, they have places where they do surgery. They have places where it's just an office area for, for doctors. So many different things like that. I've mostly, though, like for my job before, I did a lot of traveling to hospitals, actually, so larger hospitals. And yeah, I didn't have that much experience with clinics, but I do remember once upon a time I watched a documentary on healthcare in different countries, and this question about Japan was actually one of the countries that was studied in that documentary as a country with a very good healthcare and very good access to healthcare actually. Um, Even though, today I had another class with Ken, and Ken said that I think the taxes are maybe 30% for healthcare in Japan, right?
I'm not sure.
Uh-huh. He said something like 30%, and then he said that for seniors it's
Okay, and payment.
yeah,
Payment.
for payments, I think, right?
30% we need to pay, and
30% is okay.
20% the national insurance covers.
Uh-huh. Exactly. So the 30% that you guys need to pay, it's usually not that much money, right?
Yes, usually I don't pay so much. Every day I need to clinic for my arm treatment. I pay only 390 yen every day.
Uh-huh. Yeah, that's really good. Compared to a lot of the situations that we have in the US where we don't really have a national healthcare system, a lot of people are very burdened, by their healthcare costs. So, excuse me, one of the biggest things that we're seeing right now in the US where we're having a debate, actually, is a debate over healthcare,